Hi there, this is JD. I'm going to do a video about antihistamines in COVID and how to deal with treat COVID at home. There's been a lot of misinformation given out by the internet, YouTube, and many other sources about COVID and treatment of COVID and colds and bronchitis and pneumonia and every kind of upper respiratory infection. So why should you believe me and my video? Well, the reason why is because of my history with bronchitis and pneumonia. So I'll give you a little bit of background in order to establish the credibility that I have with this problem and how it relates to COVID. I was born with pneumonia and I had bronchitis virtually all the time from birth to 25. And so anyway, the way my parents helped me with that is the best they knew how to do, which is the same thing that most Americans do today. All Americans know to do is to take a simple remedy such as NyQuil or Dayquil or do nothing at all. Then their cold progresses and it gets worse until they have pneumonia or severe bronchitis. They can't breathe, and they go to the ER. And that's exactly what my parents did for me. They didn't know any better. And so I go to the ER or I go to the doctor's office, and what do I get? Well, I get antibiotics. Well, that's not the treatment for upper respiratory infection, first off. So anyway, I had this happen over and over and over until I was 25, and then I met another doctor. After all these doctors had been giving me antibiotics, I meet another doctor, also a doctor, a medical doctor, who said taking antibiotics for upper respiratory infection is a huge mistake. It turns out he was very correct about that. Believe it or not, there are people right now today, still in America, every day, they take antibiotics every day for upper respiratory infection. And remember, I'm only talking about upper respiratory infection, which means infection of your lungs, throat, nose, your airway. Lower respiration would be the respiration that occurs in every cell in your body when the cell of your body gives up carbon dioxide and exchanges it for the red blood cells' oxygen. That's lower respiration. Upper respiration includes your lungs and everything in your airway. Most people get that mixed up. They think upper respiratory is just your nose and your throat. Well, that's not true. It's everything, lungs and nose and throat. And so basically what I'm going to explain here is that point number one is never use antibiotics for upper respiratory infection of any kind. That means if you got green mucus coming out your lungs and you have strep throat and you have sinusitis, you do not need antihistamine. You do not need antibiotics for any of these conditions. And here's why. And here's what the situation is. You got to understand how does a cold or virus, a bacteria or a virus, infect your lungs and your throat and your nose. Here's what happens. The cold or the virus, including COVID, gets in your lungs, gets in your nose and in your throat, and it's irritating to the tissue. And so your body reacts by secreting a compound called histamine. Histamine is a fluid. The histamine is designed to wash out the invading bacteria or virus from your lungs or from your nose or throat, wherever that histamine tends to be. Well, what happens is that the fluid is moisture, and bacteria and viruses need three things to survive. They need darkness, they need warmth, and they need moisture. You can't take away the darkness or the warmth, but you can take away the moisture. And you do that with antihistamines. Now, got to keep in mind also that the moisture, histamine, also contains proteins and sugars, and that's what the bacteria and the virus needs to replicate. So you're being invaded by this virus. Your body secretes fluid tries to wash it out, it doesn't work, and the virus or bacteria grows, and you can actually have a virus and a bacteria at the same time. But anyway, it grows exponentially, and the result is COVID or bacterial pneumonia or viral pneumonia or severe sinusitis, all of these things. So, how you control this histamine is from the use of antihistamines. Now, what I just pointed out is that COVID does not kill you. It's your own body. You're drowning on your own fluid. That's what's killing you, and your lack of taking antihistamines. That's what's killing you. You're drowning. So it's not COVID. And how do I prove that to you? Some people don't die of COVID. Some people have minimal symptoms of when they even have COVID. Why? Because they have a naturally low histamine level. Histamine is tested by the use of the IG system. The IG stands for immune globulin. So they can actually map out your immune system. It was developed when AIDS came out. AIDS weakens your immune system. People originally thought, and were always telling me, that I needed a boost of my immune system. That's why I needed antibiotics. Well, that's not true. Antibiotics does not boost your immune system. What if you take antibiotics when you have an upper respiratory infection? What it does do is it weakens your immune system because you take antibiotics. Antibiotics get their name because they mimic antibodies, what your own body produces. Antibiotics, so it sounds on paper, it sounds like, wow, antibiotics would be great. They mimic your own system's antibodies, so therefore it is a boost, right? Well, no. What happens actually is that your own immune system goes to sleep, and then the antibiotics will tend to work once, and they get rid of the infection. But the next time you get another infection, the bacteria and the virus mutates. You notice we have different versions of the coronavirus? Right, it mutates. And then you have a new virus that defeats the fake antibiotics that you're putting in your system. What you need to do instead is dry out the virus or the bacteria by using antihistamines. Now, antihistamines don't kill the virus or bacteria directly. What they do is they keep it from replicating. It replicates with the moisture and the proteins and sugars supplied by the histamine. When you take antihistamine, it freezes the virus and bacteria, and then your own body makes antibodies because it has to work, because it doesn't have antibiotics or antivirals, and it kills the invading virus or bacteria. It can't do that if you don't take antihistamines because it's out of control. Your immune system cannot work without help from antihistamines. Now, if you take antihistamines, you'll be dry like me, and there are some side effects, but it's better than getting your lungs filled with fluid, causing pneumonia, and you going to the hospital and dying. So I basically made the point and proved that antihistamines is what people should be focusing on. Not one single anti-COVID video have I seen people focusing on antihistamines to fight COVID with. But that's what I'm saying is the answer. And it is, trust me. Over the course of COVID, I've never been diagnosed with having COVID. Although I believe I've had it because I got a really bad lung problem about 6 months ago. Our daughter went to school in August, and of course she came home with all sorts of different problems, probably involving COVID and other bacterial or viral issues. Anyway, of course, now that that I have a system in place, I took several chlortrimeton, my antihistamine of choice, and I'll talk about antihistamines in a minute, but my antihistamine of choice would be chlortrimeton 12 milligram, which is an old first generation antihistamine, and I'll talk about that and the differences in a few minutes. But anyway, the choice to take would be the chlortrimeton 12 milligram. I took like I was taking like 8 or 9 of those a day, and because of the damage to my lungs earlier, I developed a sensitivity. When your lungs are continually assailed with bronchitis and pneumonia constantly, you have a tendency to develop a hypersensitivity in your lungs. They're really sensitive. Well, basically, what you have then is asthma, and that's what I had. So, although the antihistamine I was taking killed off any bacteria or virus I had, I still had the hyper asthma. So that's a severe bronchoconstriction. You can't get your air. So I went to the ER for that. This was back in August, and they thought for sure I had COVID. I mean, I was having trouble breathing, and so anyway, the doctor even told me, he was actually a physician assistant in the ER. He actually told me, "You sound awful. You sound horrible." Then you could see it in his head how I was going in the hospital. He said, "But let's get a chest X-ray first." And I knew his next words were, "You're going in the hospital, but let's get a chest X-ray." So he got the chest X-ray. He came back. He totally changed his tune. He goes, "You don't even have any mucus in your lungs, none at all." And I'm like, "Yeah, because I've been taking 9 chlortrimeton every day, and my lungs are dry. There's no way virus or bacteria will grow in my lungs. I promise you. I'm here to get steroids because of the inflammation from the asthma." And he said, "Absolutely right." And he gave me Decadron 10 milligrams and a 4 milligram prednisone taper. I went home and I recovered just fine, as I knew I would. And I'm telling you, it's just further proof. And I've been doing this for 30 years, ever since I was 25 years old. I'm 59 now, so I've got a lot of experience with colds, upper respiratory infections, bronchitis, bronchiectasis, bronchiolitis, pneumonia, sinusitis, strep throat, pleurisy. I've had all of those things. I've had just about every upper respiratory condition that you can think of, and I know what they all are and what they all mean, but I don't have any of them now because of antihistamines, and I don't use antibiotics for upper respiratory infection. Anyway, I did, however, get the COVID vaccine because it just gives you even added benefit. But if you're an anti-vaxxer, you definitely, most definitely must be on antihistamines, particularly chlortrimeton. So let me talk about this chlortrimeton business and antihistamines. Antihistamines they're up to 3 generations now, and they're talking about a Gen 4 antihistamine. Anyway, Generation 1 is composed of, basically, it's Tavist 1, chlortrimeton, and Benadryl. And there's a couple more, like chlortrimeton's real name would be chlorpheniramine maleate. There's such a thing called brompheniramine maleate. However, I've never seen that tablet. I don't know where you would get it, but it does exist. And I'm not sure what the differences are between chlorpheniramine and brompheniramine, as I've never tried the brompheniramine. I'd like to get a hold of it. But anyway, basically the ones that are available are the chlortrimeton and Benadryl. Now, that's Gen 1 antihistamines, and that's the only ones I recommend for upper respiratory infection. Now, Gen 2 and Gen 3 antihistamines are the loratadine, the Claritin. Claritin is loratadine. Zyrtec, Allegra. These antihistamines are marketed because supposedly they don't cause drowsiness. Indeed, they don't cause drowsiness, but they also aren't as effective, and you have to take those as recommended on the label. Don't ever try to take Allegra, Zyrtec, Claritin, or any of those more than what's on the label. Benadryl is very well known. I was reading an article, a guy said, you can take 100 milligram of Benadryl all at one time. Well, that's true, you can. You can take 8 of them at one time. That's 200 milligram at one time. Our daughter did it, and she had very little reaction to it. So you can also do the same thing with chlortrimeton. How did I find out that these first generation antihistamines that you can take more. Well, I developed vertigo. If you've ever had sinusitis for any length of time, you've had vertigo. Vertigo is a spinning in your head. It's caused by an upset in your inner ear, and the treatment for that is meclizine. Well, I took meclizine at its so-called maximum dose of 1 tablet twice a day, and in my case, I kept vomiting from the vertigo, and I went back to that same doctor 5 times. Finally, on the 5th visit, he asked me, how much meclizine are you taking? And I said, 2 a day, the most you'll let me have. And he said, you can take all the meclizine you want. Well, I asked him, why didn't you tell me that on visit 1? And he told me, get out of my way, because he walked out the door. He was too embarrassed. Basically, doctors don't want you to know that you can take more meclizine, Benadryl, or chlortrimeton than what's on its label. Because why? Because if you take antihistamines, you don't go to the doctor to get antibiotics. And if you don't go to the doctor to get antibiotics or treatment for COVID or whatever, guess what happens to the doctors? They lose their population of patients, and they lose this thing. It's called money. And they don't want that to happen, trust me. So none of the doctors want this to get out, that you can take more Benadryl, more chlortrimeton than what's on its label. And remember, I also got to make another distinction. There's such a thing called Benadryl D or chlortrimeton D. Don't use that stuff. Chlortrimeton D or Benadryl D has pseudoephedrine in it. Pseudoephedrine is a decongestant that nobody should ever use ever, because it raises your blood pressure. And if you're older or younger, you shouldn't use it, because if you're younger, you need to develop a cold eradication plan that will work for the rest of your life. And those medicines are not. And don't ever, if you use chlortrimeton D or Benadryl D, don't ever take more than what's on the label, because you will run your blood pressure too high, and that's going to hurt you really bad. So remember, plain chlortrimeton with nothing else in it, or plain Benadryl. The Benadryl is easy to get. Chlortrimeton, not so easy. You can get 4 milligram chlortrimeton, but the chlortrimeton I speak of is 12 milligram chlortrimeton. You have to get that online. That would be www.chlorphen12.com. So I'll spell that out for you. www.chlorphen12.com. That would be the website to go to get the best treatment for upper respiratory infection that would include COVID, bacterial or viral pneumonia. It treats them all, because drying out your lungs is effective, and you won't get the kind of problems. These 800,000 people dying, if they had chlortrimeton 12 milligram available, they wouldn't be dying on this rate. I'm just telling you, that's just how it is. I'm just being honest with you. The doctors want to continue their money-grabbing business, and the only way they can, half of their business is upper respiratory infection. And of course, the development of vaccines. The COVID vaccine does work. It is effective, especially if you're not on chlortrimeton. You're crazy. But anyway, it is expensive, and I would say that Americans that have normal immune systems, they don't have AIDS, they're not on steroids every day, they don't need the vaccine. I took it, but I don't believe that they need it. But you definitely need chlortrimeton 12 milligram, or at minimum Benadryl. Now, there is an advantage of Benadryl. Benadryl's cheaper. It's about 4 cents a tablet on Biden's prices. It was 1 cent a tablet before Biden. But chlortrimeton is 50 cents a tablet before and after Biden. So Benadryl is definitely cheaper. However, Benadryl is only a 4 to 6 hours is what they say, but it really only lasts about 4 hours. Chlortrimeton is a 12-hour medicine. Also, Benadryl seems to cause fewer reactions for people who take antidepressants than chlortrimeton seems to have more interactions with people who take antidepressants. So you're going to have to decide which of those two antihistamines you want, but it's going to be a combination of either one, or you can take them both too, although you don't have to. So anyway, that basically concludes my video on chlortrimeton and Benadryl. I'm going to have 2 more videos. I'm going to make one on a complete cold eradication plan. I'm just speaking of chlortrimeton, the base medicine. I actually have a primary, secondary, and tertiary level of treatment for cold eradication that I'm going to go over in another video. These were way too long. And then the next video would be on coping skills, which is also a very important part of dealing with COVID, coping skills. So stay tuned for those videos. I'll see you later. Take care. I'm out.